Hi, good day. I am Mary Joy Pacot and I will be discussing about oral contraceptives. At the end of the discussion, you will be able to define oral contraceptives, differentiate the types of oral contraceptives, and appreciate the importance of learning the advantages and disadvantages. So first, let me define oral contraceptives. Oral contraceptives, also known as birth control pills, are medications that prevent pregnancy. They are one method of birth control. Oral contraceptives are hormonal preparations that may contain combinations of the hormones estrogen and progestin, or progestin alone. Combinations of estrogen and progestin prevent pregnancy by inhibiting the release of the hormone luteinizing and follicle-stimulating hormone from the pituitary gland. To avoid any confusion, let us first define estrogen and progestin. Estrogen is a primary female sex hormone. It is responsible for the development and regulation of the female reproductive system and secondary sex characteristics. Progestin, on the other hand, is a synthetic form of the body's naturally occurring progesterone, and it inhibits ovulation and reduces stretchiness of cervical mucus. There are two types of pills. First type is combined pill. From the word itself, it contains both estrogen and progestin. It works in two ways. First, they prevent the body from ovulating. This means that the ovaries won't release an egg each month. Second, these pills cause the body to thicken cervical mucus. This mucus is a fluid around the cervix that helps sperm travel to uterus so it can fertilize an egg. The thickened mucus helps prevent sperm from reaching the uterus. Next is the mini pill, a kind of pill that contains only one hormone, the progestin. Mainly, it works by thickening the cervical mucus and by thinning the endometrium. The endometrium is the lining of the uterus where an egg implants after it's fertilized. If this lining is thinner, it's harder for an egg to implant in it, which will prevent a pregnancy from growing. There are types of combination pill. First is the monophasic birth control pill, which delivers the same amount of estrogen and progestin every day. These are used in 1-month cycles, and each active pill gives you the same dose of hormone. During the last week of the cycle, you take inactive pills and have your period. This type of pill is less likely to cause side effects that is a result from fluctuating hormones. Examples are Upre, Desogen, and Levlite 28. Second is the biphasic birth control pill, which deliver the same amount of estrogen every day for the first 21 days. During the second half of the cycle, progestin or estrogen ratio is higher to allow normal shedding of the uterus lining. Examples are Janis 28, Mercet, and Orthonovum 1011. And lastly is the triphasic birth control pill, which contain 3 different doses of hormones. Hormone combination changes approximately every 7 days throughout the pill pack, may have a slow increase in estrogen, and some may also increase the dose of progestin. Examples are Trifacial 28, Yaz, and Low Estrin 24-4. Mini pill, or also known as progestin-only pill, contain progestin without estrogen. This type of pill may be a good choice for women who can take estrogen for health or other reasons. With these progestin-only pills, all pills in the cycle are active. There are no inactive pills, so you may or may not have a period while taking mini pill. So some people may ask, are all kinds of birth control pills appropriate for everyone? The answer is a no. Of course not. Because your healthcare provider will ask about your medical history and any medications you take to determine which birth control pill is right for you. Your healthcare provider may discourage use of combination birth control pills if you are breastfeeding, are older than age 35 and smoke, have poorly controlled high blood pressure, have a history of or current deep vein thrombosis or pulmonary embolism, have a history of breast cancer, and have unexplained uterine bleeding. There are also advantages or pros of using birth control pill. First is the decreased risk of ovarian and endometrial cancer. It helps in the improvement of acne. It helps in lessening the severe menstrual cramps or dysmenorrhea, reduces heavy bleeding or menorrhagia and related anemia, and relief from premenstrual syndrome or PMS. There are also disadvantages of using birth control pill. First, it may cause headaches and mood swings, requires keep track of the number of days taken, may cause breast tenderness, nausea, and weight gain, and some may develop high blood pressure because of the estrogen content of the pill, and it does not protect against HIV infections and other sexually transmitted infections. There are also side effects of birth control pills, and let us first discuss the non-severe ones. First is headache. Next is dizziness. Third is breast tenderness. Fourth is nausea. And lastly is mood swings. For the severe ones, first is blood clots, pulmonary embolism, heart attack, and kidney stones. There are also risks of using birth control pills. First is a deep vein thrombosis, next is a heart attack, and lastly is a pulmonary embolism. So how effective are birth control pills? If taken correctly, oral contraceptives are effective in preventing pregnancy. According to CDC, or Centers for Disease Control and Prevention, both the combination pill and mini pill have 9% failure rates with typical use. That means out of 100 women using the pill, 9 would get pregnant. So the bottom line is, you have many options for birth control pill. If you choose to take birth control pills, work with your healthcare provider to decide which type of birth control pill is right for you.